This video is designed to assist you in providing culturally competent healthcare for patients with disabilities and special healthcare needs. Cultural competence is the ability to interact effectively with people from different cultures. Cultural competence means to be respectful and responsive to the health beliefs and practices and ethnic and linguistic needs of diverse populations. Specifically, we will discuss how race, ethnicity, and culture influence the treatment of a person with a disability, including how these factors may influence how the person and the family view the disability, how these factors may influence and impact treatment outcomes, and how these factors may influence the relationship between the healthcare professional and the patient. In order to give you a foundation for cultural competence, we will define what we mean by race, ethnicity, culture, and diversity. Race is a division of humankind possessing traits or characteristics that are transmissible by descent. Ethnicity is how you see yourself and how others see you as a part of a group with a shared heritage. Common threads that may tie one to an ethnic group include skin color, religion, language, customs, and regional characteristics. Culture is the learned and shared knowledge that specific groups use to display behavior and interpret their experiences. Diversity is a concept that includes the range of visible and non-visible qualities and values that shape a person. You will now hear from two family members who will introduce you to providing culturally competent services to patients with disabilities and their families. Some of the themes that will be discussed are implicit bias, navigating the system, cultural differences, role of the family, and language and communication.
Hello, my name's Ariana Aaron. I'm an Iowa City native and I have two boys. My oldest son, Amarin, has received services here at the Center for Disabilities and Development since he was 2 years old.
Hi, I'm Karen Weber Gasparoni, and I am the mother of a lovely daughter with special healthcare needs. Her name is Natalia. When Natalia was 11 years old, we moved from our native country, Brazil, so I could pursue my studies in pediatric dentistry.
Many providers operate under preconceived notions about ethnicity, socioeconomic status, and other factors. This is often referred to as implicit bias. This has an effect on the healthcare professional's relationship with the patient and family.
I actually dealt with a lot of things that I would say had to do with my race when my son got his first diagnosis of autism. I felt that I had to please the people that I was seeking assistance from. I didn't want them to have these judgments of me that I felt that they already had. I wanted them to be able to respect me. So I was like, okay, what do I have to do to make sure that they see me how they would see any other person coming into this room right now, from any other race, any other gender. I want them to see me for me, and I want them to see my son for who he is. Everyone is different. No matter if they come from the same culture or not, they've experienced different things. I do not like to be grouped, and I felt oftentimes that I was grouped into the single black woman stereotype. Young mother, she doesn't know a whole lot, and so we can kind of steer her where we want her to go. That is noticeable to me, and it is noticeable to anyone else that is being treated that way.
We need to refrain ourselves from being judgmental towards the parents and towards the child. A lot of individuals with special healthcare needs may have a lot of behavioral issues, and it's so easy for us to label parents as being bad parents, as not knowing how to redirect their child's behavior. I went through this a lot, especially when Natalia didn't have a diagnosis. I was labeled as being a bad parent. And I think it's very important that we take our prejudice away as far as possible and try to understand the struggles that the family is facing and help them find strategies and learn techniques to redirect their child's behavior instead of jumping into conclusions.
I found a lot of the service providers thought that they knew what was best for me, or they knew what was best for my son, or he's acting this way because you're not doing this, or he's not doing this because you're not pushing him hard enough. Things like that, which was very insulting because of course I was going to be working on these things with my son. I wanted him to be better. I wanted him to show progress. And this was something new for everybody, but I worked just as hard as my son was working, and I wanted other people to be able to see that.
Many of your patients may need assistance navigating through the array of services and resources available to them and their families.
Every time you're new to a new location, especially from one country to another, a lot of times families are not aware of what services are available. And they're also not aware of who are the healthcare providers that should be part of the team, the healthcare team that will be taking care of their child. I was not aware of all the services that were available for Natalia. I did not know what questions to ask. I did not know where to go. I had simple questions of how much my insurance is going to pay for all the services that are provided for her. Where should I go? With whom should I talk to? So having health professionals who were sensitive to my struggles, to my lack of knowledge of what it was available for Natalia was key to provide what she needed at that specific time of her life. So as health professionals, we should never miss the opportunity to ask the questions. If the parents are aware of these services, what are the difficulties they're having to navigate the system, and take that extra step to help them not only understand the system, but also navigate the system.
Cultural differences and experiences can influence how an individual and his or her family may perceive and respond to disability or treatment recommendations. Being aware of these differences is critical to communicating effectively with the family to maximize healthcare outcomes.
In the African American community, there is a huge stigma with being diagnosed with things, seeking help, any type of diagnosis. It's you'll be fine. You'll get through this. Keep your head up. And so initially when my son was given this diagnosis, I wasn't hesitant to get him the services he needed, but I was hesitant to let people know about his diagnosis. We
parents of individuals with special healthcare needs, we go through different stages. First, you feel guilty. You feel that you have a child with special needs because probably you did something wrong. You feel ashamed. You feel sorry for yourself, which is the worst, until the point that you come to realize that this is the very best thing that has been presented to you in your life. You may get a parent in a different stage, and you have to be loving, and you have to be compassionate, and you have to be understanding that parents are going to react differently to their child's special health care needs.
The role of the family in different cultures can vary. Family involvement comes in many forms and can be highly influenced by culture.
In some places where I would go, a lot of the times it would just be myself and my son. They eventually started asking, oh, okay, well, where's dad? And what does dad do? And is dad in the picture? Does dad in the household? Those were all things initially like, okay, these are some things that they probably need to know. And are me and dad being consistent in how we're working with them are in? But then I found that they would be like, oh, well, why is dad never here? Is this something that's really important to dad? Dad is in the household. Dad works 2 full-time jobs to make sure that we have what we need. He's very much involved with his children's life, and just because he's not here at these appointments with us does not make him any less involved than myself. Every family is set up differently. No matter how a family is set up, that shouldn't determine the level of respect that we receive from people.
When you are from a different culture, you have different relationships with your friends and your family, and you have a different support system. Family is very huge in a Latin country. We tend to be overprotective. We tend to be sometimes overbearing as well. And so I would not be surprised if, families from different cultures would listen more to their family members than actually to the professionals that take care of their children.
The language you use, whether verbal, facial, body, or otherwise, may be interpreted or understood differently by various cultures. Remember that patients want to feel heard and that language barriers may present additional communication challenges in your practice.
So in the language that providers would use in a way that made me feel less than or felt like they were maybe trying to stereotype me is they would take a long time trying to explain one thing to me as if I wasn't following or not understanding. When I would have a comeback and they'd be like, oh, okay, you do get this. You're understanding this. Is this making sense? Yes, I'm following 100%. Some of it was just making sure that I understood what they were saying because there was a lot of new information that I was being given. One time we were late to an appointment. We didn't miss it. We were late to the appointment, and typically I would call, but it was a crazy morning and I felt very bashed almost when I got there about why were you late, and where you could have called and our other families would have called. But I didn't know how to speak on it without sounding rude or like the angry black woman. Another thing that I ran into a lot is how appearance plays a role. I have almost the full arm of tattoos. I have piercings. I express myself in various different ways. And so oftentimes I would have a phone conversation with someone and then go in to meet them, and they'd kind of be like, I wasn't expecting this person to be walking through this door right now. And they weren't always 100% sure how to address me. I would notice like their eyes would travel to my head wraps a lot of the time and trying to figure out, okay, well, we thought she was black, so why is she wearing a head wrap? I would find people who would just ask the questions. It made me feel more comfortable about the situation instead of me feeling like, why do they keep staring at me? Why are they looking me up and down? Myself, and I would go ahead and say a lot of people of color, we notice those things very quickly. But also it's something that our children notice. When it comes to dealing with kids of color with special needs, it's something that I think service providers should be more aware of.
As an educator, I talk a lot about what we parents of individuals with special healthcare needs expect from other health professionals. And what do we expect? We expect a lot of respect. We want to be part of this health team. We want our voices to be heard because no one knows our children as much as we do. And as a parent, I see myself going back to those health professionals that treated me and my daughter with respect. We need to be humble, to be open to the parents' idea. And we also need to be sensitive that they come with different cultural baggages and be sensitive to their needs. Language barrier can be very challenging for both the families and the healthcare providers. In many situations, we have parents that have just relocated from their countries and they don't feel comfortable with the language. And it's very important that we not only are able to communicate the preventive measurements, but the treatment that we want to provide, but also that we are able to answer their questions adequately. Therefore, it's very important for us health professionals to take that extra step to find out if the parent cannot communicate, if there is anyone available for translation. And a lot of times, the families do not know that services are available through hospitals, through dental schools, through translating phone systems. So knowing this in advance will help the communication improve a lot during the appointment.
In summary, cultural competence is the ability to interact effectively with people of different cultures. We'd like to leave you with some additional tips and suggestions as you strive to deliver culturally competent care to your patients. Consider patients first as individuals, then as members of a multicultural group. Do not assume that ethnic identity tells you anything about a person's values or behavior. Treat learned facts about cultures as hypotheses. Engage your patient actively in the process of learning what cultural content should be considered. Be aware of your own attitude about culture and ethnicity. Demonstrate interest in and respect for the patient's traditions and customs. Consult traditional healers and spiritual leaders as appropriate. And recall that respect and courtesy are always culturally appropriate. While we realize that one voice does not speak for all families, we do hope that the perspectives and considerations presented in this video will guide you in providing high-quality care to patients with disabilities and special healthcare needs who represent diverse culture and ethnic groups.